The reason I decided to get the vaccine is for my son because I work at Touro, so I work around COVID positive patients all day, and I want to go home and be healthy for my son, and I don't want to pass anything on to him.
Because I think it's the best thing to keep my family safe, my colleagues safe, and the community safe.
Because I believe in science and that they're here to help us all have a healthier community.
To protect myself, but more so to protect all of my pregnant patients, and I can hug their babies, hug them again. I'm also doing this for my husband and my dear sweet patient who is hospitalized right now, but I hope you pull through.
Because it was worth it to get the vaccine. It was too much going on, bringing germs home.
To protect my patients, my family, my friends, and hopefully put an end to this pandemic.
Because first of all, I work in a hospital around everyone. I work in full service where everyone comes to eat, inside patients, inside employees, and visitors. My daughter have diabetes, she's on the front line, and when I go home, I want to go home healthy to her.
Obviously, as a frontline healthcare worker, I want to set an example for everyone else, but also I'm not really taking it for myself. I'm taking it for my family, my 2 daughters, my wife, my elderly parents. It's the right thing to do.
It's not only to protect myself, but protect the patients that I'm taking care of, especially in my patient population, which consists of pregnant women and their unborn children. I think it's very, very important for this special population, but also me going home and exposing potential family members who may be at risk as well. So I think it's very important, not only for myself, but also for everyone that I may be potentially exposed.
Thanks everyone for joining us on our Vaccine Education Day. This is a question and answer town hall that we're holding. Please, if you're viewing, please text your colleagues to ask them to join in. As you may or may not know, there is free grab and go lunch in the cafeteria today. We have this town hall on screens, both in Cafe Touro and in the President's Room. So please text and send your colleagues to that. I'm Dr. Chris Leger. I'm your Chief Medical Officer here at Touro. And I'd like to introduce the panelists and experts that I have with me today on this Zoom call, who will be available to answer questions. First off, we have Makiba Jones. She's one of our clinical pharmacists here at Touro. Please wave to the camera, Makiba. Thank you. We have Dr. Julio Figueroa, who is a LSU professor of medicine and the chief of infectious disease there. We have Dr. Asha Hurd, who is a LSU associate professor in the section of maternal fetal medicine, and she's also the OBGYN residency program director there. We have Tara Morse, Dr. Tara Morse, who is our medical director of our OB hospitalist program here. And then we have Brittany Pearson, who is a family nurse practitioner with Uptown Nephrology, and also an expectant mother. Brittany, wave to the camera for us. Maybe she can't hear us. So anyway, I want to welcome everyone to this. I want to start off with a couple of just topics and points from me personally. And then I have some sort of canned questions we're going to ask the panelists. If you have questions, if you're viewing, you can enter those questions through the Zoom chat function, and we will try to get to those questions as we go along here. So our goal today with this Education Day is to really encourage more of our staff to get vaccinated. All of us on the call really feel very strongly about the importance of vaccination and the safety of vaccination, that we want to encourage additional staff members to sign up for vaccination. Informationally, Employee Health does have a sign-up table currently in Cafe Touro. We are offering first dose vaccine for staff. There are appointments tomorrow and additional appointments next week to get that done. Just informationally, while it's on my mind, we also are holding a raffle to auction off prizes. So everyone that's already been vaccinated, Employee Health is providing those names to marketing. And then anyone that signs up to get a vaccine appointment who hasn't yet will also be entered into the drawings. We have some great prizes to give away. to everyone that's either fully vaccinated or who agrees to get vaccinated. So currently, I'm happy to announce that we've had 976 of our Touro employees who have already completed vaccination. That's about 64% of our staff. We've had an additional 257 CCPI employees. That's about 67% of the staff at CCPI. We've had 75 Aramark employees, which is about 49% of those staff. And we've had just under 250 of our physicians and providers on staff here at Touro also become fully vaccinated. Our goal with this Vaccine Education Day, we'd really like to get up to a vaccination rate of 75% or higher across our hospital. That is one of the definitions of herd immunity. We'd love to get to herd immunity amongst our own staff and colleagues here at Touro. As you may have heard and seen in the news yesterday, the country celebrated, I use that with asterisks, its 500,000th death yesterday from a disease we knew nothing about a year ago. And that's a pretty startling statistic. But on the positive side, Louisiana actually has now vaccinated over 50% of its 70 and older population with at least one dose of vaccine. I think that's a very positive number. And across Touro and our vaccine clinic across the street, we will be administering later this week our 10,000th vaccine in someone's arm. So we're very excited, happy about that. That gives us quite a bit of experience with this vaccine, the ability to answer questions, not only with what science tells us, but also with real life experience that we've had over these past 2 months. We've now been doing vaccination for a little over 2 months now. So I'd like to turn to one of our panelists first, Dr. Figueroa, with a question, a very simple question that I'll let you answer as you will. The question is this vaccine safe?
That is the question that everybody's asking, and the more experience, as Dr. Leger mentioned, the more experience that we have with this vaccine, the more comfortable we are with that. Clinical trials show that it's a very, very safe vaccine, and that the major side effects are local and usually go away within 24 to 48 hours. But the vast majority of individuals that have taken the vaccine don't have a lot in terms of systemic symptoms, and that has been our experience here in New Orleans as we've been using the vaccine. There is a little bit of a concern concerning the allergies. That was a big thing that happened as soon as it was rolled out, but CDC has been tracking that, and that actually turns out to be a very rare event.
Excellent, thank you, thank you. I'll move over and ask Makiba a question that we see. We have a lot of staff who are asking and sort of have this wait and see approach. And so what we'd like to hear from you, Makiba, is actually, what did you feel? What were your side effects when you had your doses, both first and second dose? Just give us your experience as one of our staff here.
Well, for me, I didn't want to wait. I actually wanted to be the first one that they injected in the arm. It didn't work out that way, but I wanted to be first. I received my first dose right before Christmas. And believe it or not, right at the first of the year, I tested positive for COVID. Totally asymptomatic. A family member that I come in contact with ended up testing positive, and we all got tested. My son and I actually tested positive. I had absolutely no symptoms the whole time that I was out. I came back to work after being quarantined and went straight and got my second shot. And I did well. I didn't have any side effects other than just a little soreness in my arm, and that was pretty much it. So I'm happy that I did that.
Excellent, thank you, thank you. Dr. Hurd, I have a question for you. And I guess my question is for women who fall into the category of being either an expectant mom, a new mom, or a woman who is of childbearing age who may want to get pregnant in the future. What's your advice for these staff members regarding safety and any words you might have to encourage them to go ahead and get vaccinated?
Yeah, thanks. Hi, everybody. So I'll kind of take each of those groups a little bit separately and kind of talk about each one. So for women who are thinking that they might want to become pregnant in the near future, or who may get pregnant in between dose 1 and dose 2, there's a lot of misinformation out there on the internet about the theoretical risks of effects on fertility, and none of that has actually been proven through what we know about the way this vaccine works. And so if you choose to get vaccinated and you are planning on becoming pregnant, there's no recommendation. You don't need to delay pregnancy after you get vaccinated. If you happen to become pregnant between dose 1 and dose 2, you can still get dose 2 as scheduled. For employees who are new moms or maybe breastfeeding, getting the vaccine protects you, which in turn protects your household and protects your baby. We don't yet know exactly if moms can pass along antibodies through breast milk, but in theory they should be, and as more information becomes available, we'll be able to answer this question a little bit better. But even with the possibility, that should be encouraging to moms who are breastfeeding. For patients who are pregnant, most of you might be aware that the governor has recently extended eligibility to our pregnant moms, which we on the obstetrical side are very excited about, the opportunity for our pregnant patients to get vaccinated. Both the American College of OBGYN and the Society for Maternal Fetal Medicine are in support of pregnant women being able to make the decision to get vaccinated. What I know that a lot of pregnant women are concerned about is that there's not a lot of data on the vaccine in pregnancy because pregnant and breastfeeding women were not included in the original trials. That wasn't because of a safety concern. That's actually pretty common, unfortunately, for vaccine trials to exclude pregnant and breastfeeding women. And based on the way the vaccine works, we don't anticipate that there would be any significant risks to pregnant moms, with the potential benefit, again, of possibly protecting your baby as well.
Great. Thank you, Dr. Hurd. I'll move on to Dr. Morse with a question about, and maybe if Dr. Hurd hadn't touched on it, what you would consider potential complications for a pregnant mom who actually got COVID during pregnancy. In other words, arguing for vaccination to prevent COVID in pregnancy. And then if you would just share your thoughts also on breastfeeding and the vaccine, since I think you may have some experience there.
Just a little. Dr. Hurd eloquently put it, we don't want our pregnant patients to fear getting vaccinated. There's a lot of misinformation on the internet. So the thing that we really do know is when you look at pregnant women compared to their non-pregnant counterparts, pregnant women are at higher risk if they do get in contact with COVID and become symptomatic or even asymptomatic, are at higher risk of hospitalization, are at higher risk of ICU admission into the hospital as well for their symptoms, higher risk of needing a ventilator. Along with all of that, and Dr. Hurd can attest to that too, comes some other complications. If these women get really sick, respiratory function declines, sometimes this could put them at risk for needing a preterm delivery. And so there can be risk for the infant for that, depending on what gestational age or how far along in their pregnancy that they're delivered. That's why both of our colleges, ACOG and the Society of Maternal Fetal Medicine, recommend that pregnant women do receive the vaccine because the risks of getting COVID in pregnancy do appear to be much higher than their female counterparts. So, we do encourage that. And that's something that a lot of moms do talk to us at the hospital, and even employees that are currently pregnant will sometimes stop us in the hallway and ask our opinions. And I think all of us on the unit and on the floor in OBGYN really advocate and support that. As far as breastfeeding, I was a breastfeeding mom. So there's no data. There was no data out there to tell me one way or another when I chose and elected to get the vaccine. But anything, in my opinion, that I could do to protect my household and protect my children, and then potentially give some benefit to my daughter, was ideal. We don't know if the antibodies pass in breast milk, but of other vaccines that we get in pregnancy that we have literature on, we do see that does happen. So I'm hoping that my 16-month-old has a little like antibody support to protect her against COVID and keep our household safe. So we would really encourage pregnant moms to get that. And I understand that's scary, but it's something that they're really doing to protect their household in general of being safe.
Excellent. Thank you. Thank you.
You're welcome.
So I have a question for Brittany. So Brittany, who is an expectant mom and who did get vaccinated, can you talk us through some of your decision making going into the vaccine itself? So sort of what your thought process was to make the decision to go ahead and get vaccinated.
Absolutely. So my husband and I found out that we were going to be expecting our second child in the beginning of August. And at that point, there had been talks of a vaccine, but we really didn't know what was going to happen. And as Dr. Hurd had touched on too earlier, even in school, you always learned that pregnant and breastfeeding mothers were generally excluded from all clinical trials and all clinical research. So I kind of had the idea that if something did come out, I would kind of be one of the last groups to actually be eligible to get the vaccine. So one of the things that really kind of scared me was the fact that there's an increased risk of preterm labor. And I didn't really want to risk that. I'd heard many reports from other OBs and stuff like that. So once the vaccine came out, I did discuss with my OB, Dr. Rebecca Pratt, as far as what I should do if I should get the vaccine. And her words to me were, the risk of getting COVID is far greater than the risk of actually getting the vaccine. Another thing that kind of came into it too was I have a daughter at home that has a complex congenital heart defect, and we don't know when kids are going to be able to get the vaccine. So I felt that by me getting the vaccine, this is not only my way of not only protecting myself, my daughter, but also to protect my patients and some of our older family members too. And that's one of the reasons why I got it. And then also, as Dr. Morris had also touched on, we don't really know if the vaccine, if it's passed on through breast milk, but in the event that it is, I would like to be able to pass that on to my baby and the benefits from the vaccine.
Awesome. Thank you, Brittany. So I'd like to do a bit of a roundtable real quick with the panelists with a very simple question. You may have already partially answered it, but I'd like to hear your thoughts again on why you personally chose to get vaccinated. The one thing I'll say first for myself, I'm a firm believer that the vaccine is how we end this pandemic. I'm not going to touch on it, but I think we're already starting to see some of the benefits of that, even in our own community. But I'll mention the other thing that struck me out of all of the vaccine trials when I looked at them, and that and Dr. Figueroa can correct me if I state this wrong, but over 75,000 people in the vaccine trials of these 5 major vaccines that are out, not a single patient died of COVID. So I knew getting this vaccine that I am not going to die of COVID. I may still get COVID. We don't know that yet. I hopefully will be less likely to give COVID to someone else, but I'm not going to die of COVID. And I've seen enough death from COVID. So I'll turn it over to Dr. Figueroa to sort of give us his thoughts.
Ditto in that scenario. I mean, I think that the major things are that the vaccine is so incredibly effective. I mean, nobody in that July timeframe when they were starting to roll these things out were thinking about the fact that it was going to be 95% effective in terms of preventing symptomatic COVID-19. I mean, that is like out of the park, amazing, right? And then in addition to that, as Dr. Leger mentioned, as far as I know, there haven't been any deaths in vaccinated individuals. Now, we would anticipate that there may be some in the future, but it's going to be much, much less than what we're seeing right now. And I think the other thing that sort of drives me to do it, drove me to do it, is that it's really hopefully the ability of me to prevent spreading to other people, because we are all kind of in healthcare and we're being exposed, whether we want to or not, or unknowingly. And it looks like the data there are beginning to develop that this vaccine, the Pfizer vaccine in particular, but also Moderna, decreases the amount of virus that's shed and decreases the number of people that actually get the virus once you get vaccinated. So that actually is very exciting because that actually will allow us to really protect our population so much better.
Thank you. Thank you. Makiba, I'll go back to you. Just any further words about your choice to get vaccinated? I know you spoke about it a little bit earlier, but any additional comments?
Yeah, I truly trusted the science. For me, I never had any problems ever getting vaccinated in the past with any other vaccines. And to be quite honest, COVID scared me. I mean, in my career, I don't think I could ever say that I was afraid of anything. And COVID literally had me afraid. And I felt like getting the vaccine, that was another layer, like a weapon in this fight, you know, other than having a mask and socially distancing. It felt like a monkey was lifted off my shoulders after I got that second shot. And I knew that I was like you said, I was protecting my family, some of the elders, my mom, my dad, you know, my kids. So it was a win-win situation for me to get it.
Great. Well spoken. Maybe our sharpest weapon, hopefully. I'll ask Dr. Hurd for her comments. Same question.
So I'll admit that in the very beginning, I was skeptical, like many of you probably are. And so I went to the data and I read the science. And I talked to colleagues who I trusted, who had also read the data. And you know, I'll echo the fear. I'll echo the you know, we've all, to some extent, some more than others, have seen the devastation that this virus causes. And I want to be part of the solution. And so I decided to get vaccinated to protect myself and my family. I have 3 young kids. I haven't seen my parents in a long time, my mother-in-law who's older. And so, and I take care of a high-risk patient population. And so for all of those reasons, I decided to get vaccinated. And I'm really glad that I did.
Great, thank you. Brittany, I know you spoke about this quite a bit, but any further comments about your decision?
Again, I think the decision really came down to the fact that it wasn't just about myself. It was also about protecting my patients. I mean, I deal with dialysis patients, so we also have a high-risk patient population, and I have some older relatives and everything. And like Dr. Hurd, too, the way she touched on, you know, when the vaccine first came out, I honestly was a little hesitant just because you were always taught that, you know, that in pregnancy, women are usually excluded from clinical trials. So I also had to kind of go back to the research and the data that had been published by the pharmaceutical companies and also the CDC to kind of help with my decision. And then of course, my PCP also kind of weighed in on everything and kind of helped me make the decision. But I honestly also had a lot of patients who had lost a lot of family members, and I felt like a lot of them were really the morale. They were very depressed because there were so many family members that weren't really making it. And the virus, unfortunately, was not taking a while to cause mortality and morbidity in some of these patients. It was very quick in some of these patients. So I've always believed in vaccines and the technology behind them. And that kind of solidified was the only way to solve this virus and to attack it is to get vaccinated.
Awesome, thank you. And Dr. Morse, any comments about your choice and decision?
Yeah, I mean, I think I'll echo. I definitely had fear too. I mean, it was new. Let's talk about how they go through these clinical trials. There are always these long, drawn-out processes, and this was something that was, you know, a little bit faster. But there still were the appropriate phases that happened. And I think, you know, as a parent, I'm definitely that mom who is like, if I can delay and break up my kids' vaccines a little bit off the shot schedule to decrease that load, I have that little bit of that in me. But when it came to the COVID vaccine, like Dr. Hurd reiterate, like the literature is there to support it. And it was not something that delaying it would have any benefit to anyone, right? I needed to be a solution to the problem. I needed to get to the point where we could have herd immunity, and having witnessed and seen how devastating COVID could be to the pregnant patient we took care of, a year ago, this time in March and February, it became a no-brainer. It was like, I trusted in the science, I trusted in the technology at this point, and there was no benefit in my mind of waiting to just wait this out 6 months and see what happened. The benefit was really now to gain that herd immunity and get myself vaccinated for my family.
Great, thank you. I do have a few questions that have been posed that I will pose. The first one I'll ask of Dr. Figueroa. So the question is, if I have already had COVID, do I still or should I still get the vaccine? So how would you answer that?
So the current recommendation is to go ahead and get the vaccine. The variability and the antibody levels in patients who have had COVID is sufficiently there that that vaccination is going to give you much higher titer than you would from natural infection. So at least one dose. You may have heard on the news that there's some controversy about the second dose and all that other stuff. I think at this point in time, one dose for sure, second dose probably as well. It's not going to hurt by doing it, and since you're able to get it, definitely would recommend it. Length of immunity is also probably going to be better with the vaccine than not.
All right, thank you. Dr. Hurd, I'll ask you, if you answered it, I missed it, but you talked about breastfeeding and the transmission of antibodies, but what about pregnancy?
Yeah, so there's actually been some pretty recent data that's emerged over the last couple of weeks that tested moms who actually had COVID in pregnancy. And they did find in the majority of those, in the cord blood of the majority of those babies, there were actually COVID-19 antibodies. And so what that means is that if you have COVID during pregnancy, and hopefully if you get the vaccine during pregnancy and you make antibodies, then there's a high chance that you could pass along those antibodies to your baby, thus protecting your baby from COVID. And so I think, even though the data on the vaccine itself is limited, we should be getting some more information soon about the passage of antibodies to the baby. And I think it sounds very reassuring at this point.
Gotcha. I'll punt this question back to Dr. Figueroa, and there may not be an answer, but I'll ask his opinion. The question is, how often will we need to be vaccinated, and will it be offered annually?
So that speaks to the duration of immunity, which the vaccines were starting to be tested somewhere in the July timeframe. So we know that that neutralizing antibody titers have been pretty high for those 8 months. And as we get more experience, we'll get to know how long the immunity lasts. So the second question is in terms of variants. So as we have different variations of the virus going through the community, there may need to be some modification of the vaccine in order to be able to cover those variants. So that's the answer I would give. We don't know how long the immunity will be, but it seems like you get pretty high titer of neutralizing antibody, and it seems to maintain itself at a pretty high level. So hopefully at least a year, maybe several years, unless the variants can become an issue.
Perfect, thank you. I want to do one more roundtable. Makiba already answered this question, but I would like to hear from all the panelists about their own experience with the vaccine from a side effect standpoint, in all honesty. And I'll give my own experience that I did have a pretty sore arm after the first dose. And after the second dose, after it was about 12 hours, I felt pretty tired. And had that same sore arm, but outside of that was pretty symptom-free otherwise, and that fatigue really, that tiredness really went away within one day, and I had no problems getting through a work day. Dr. Figueroa, your experience?
I would echo that. I think the sore arm was pretty typical for vaccination. I mean, you get flu vaccine every year, you get a sore arm for the most part anyway. And then after the second dose, I did get about 24 to 36 hour fatigue that then went away pretty quickly.
Perfect. Brittany, how about you?
I had no problems at all. I think I had a sore arm after the first dose. And after the second dose, I did not even feel the needle go in. And I woke up the next morning and was chasing my 3-year-old around. So I had no side effects at all.
Perfect. Dr. Morris?
With the first dose, it was mainly just a really sore arm. And the second dose, a sore arm with just some generalized fatigue, a little muscle ache, nothing awful, nothing that I couldn't work through. I worked the day after I got my second dose. And then just kind of a little minor headache, but I just kind of felt a little under the weather. But again, like I said, it was nothing terrible. I was able to work through it fine and work a full shift. So.
Perfect. And Dr. Hurd?
I had a sore arm after the first dose. After the second dose, I also had a sore arm, probably a little bit more than the first time. And then the next day, I had some fatigue and a headache. But I kept joking with my husband that, we have 3 young boys that I chase around all the time. So it really just could have been because of that. Not quite sure, but that's all I had. So 24 hours after the second dose.
Perfect. And what I'll say to everyone who's watching, as I said, we've had over 50% of the Louisiana population of 70 and older now get the vaccine. So I bet everyone knows an elder that's a relative or friend who's gotten the vaccine, who can share their experience with side effects. I sort of feel like if we're comfortable vaccinating that population and how well most of them have done that I have experience with, I think that's another testament to the safety of getting vaccinated, and so to encourage that. That's the end of the questions. I would like to open and have the panelists give any final comments. No pressure, but anything we may have missed that you might want to say before we sign off of the town hall.
So let me just mention a few things. First of all, the technology that's being used for the Pfizer and the Moderna vaccine is a technology that's been around for over 10 years. Okay, so this is not something that was developed yesterday. It is the first implementation of a commercially available vaccine. The technology that's being used, this mRNA technology, is really about trying to customize things for cancer patients. That's how it was kind of initially developed. And so to try to boost the immune system for cancer patients. And then when COVID-19 hit, they used, these 2 companies used that technology in order to be able to address this particular issue. So this is an old technology. There's lots of good data in terms of safety. There's not any issue in terms of changing your genetics or anything like that. That's really not there. And then the third thing that I want to mention is that there's no way that you can get COVID from this vaccine because it's only a small part of the spike protein, which is the part that actually gets into our cells, brings the virus in. It's a small part of that, and so that is not the whole virus, and it can't even potentially even generate the whole virus. So that this is probably the cleanest kind of vaccine that you are going to be able to see. And I really think it's an amazing thing that is so effective and right out of the box. I mean, I think it's a really fantastic achievement in science, and I really, really encourage everybody to take it.
I think also one thing that I think a lot of people are afraid to is also whenever you're pregnant, you also are encouraged to get the flu shot and also the Tdap. And I think a lot of people kind of question if you're able to get those vaccines if you've recently gotten the COVID vaccine. And I think as long as you have that 14-day waiting period, you're still able to get other vaccines too. I think a lot of people are very confused about that, but that was one thing, just because you get the COVID vaccine doesn't mean you can't receive the flu shot or other vaccines too. So that's another thing that I think a lot of people have kind of questioned.
Thank you, Brittany.
I'll just add a couple of things. I alluded to this earlier, but there's so much misinformation going around the internet and social media, particularly as the vaccine relates to pregnancy and breastfeeding and fertility. And so, even from talking to my own patients, I know that folks have a lot of questions. And so I really, really, really encourage the employees and the folks listening on this call that if you do have questions or you heard something, call your doctor, talk to one of us, reach out to one of us, and ask your questions, and we can help try to clear up some of the misinformation that is out there.
Thank you. The one other question I'll answer was that if I get vaccinated, can I stop wearing a mask? We want to remember that as of right now, only about 12.5% of the population of Louisiana has gotten one shot. Only 6.5% have gotten both shots. So there's still a lot of people out there who are susceptible to COVID. As Dr. Figueroa said, the data looks good that once you're vaccinated, you may not be able to spread COVID to other people, but it's not 100% clear yet. And so the short answer is in areas where it's required, you obviously do still need to wear your mask. That includes in our hospital. But even amongst your friends and family and those that have not been vaccinated, it's still important to practice those good practices with social distancing and masking. But just realize that you yourself are protected, and we hope to ultimately find out that you are protecting other people by getting vaccinated. Before we sign off, I want to remind everyone that we are signing up people for vaccine right now in Cafe Touro. So feel free to go down there, stop by and make an appointment. You can also, if you don't get to do that today, can schedule through your supervisor. We have appointments available tomorrow and next week. We'll be moving employee vaccinations over to the vaccine clinic after next week. So next week's not the last opportunity. It's just your best opportunity right now. And I want to remind everyone that we have giveaways for those that sign up. And there are goodies available in Cafe Touro, including a nice orange mask, which echoes the orange sticker we have on our ID showing that we are vaccinated, as well as free lunch in the cafeteria today, as well as free dinner. I want to thank our panelists again for joining, sharing their expertise and their experience. I know it was very illuminating for me, and hopefully illuminating to all of you that are tuned in. Please share with your colleagues, encourage your colleagues, jump up and down, whatever you need to do. Let's get our colleagues vaccinated, continue to spread that word out to our community so that we can ultimately see an end to this pandemic. Thanks, everyone.